Recently I was shared with a particular biometry sheet of a patient who underwent cataract surgery with a trifocal IOL, and seemed to be not happy with it. While there could be many reasons for the dissatisfaction, the purpose of my sharing this particular case is to see how could we pick particular signs from the biometry sheet and avoid choosing such patients who may not be a good candidate for multifocal IOLs. Some time back I had published in my website, quickguide.org, a chart that gives guidance on right patient selection. The particular area of the chart that is connected to this patient is the pupil size. Some amount of anisocoria, that is difference of pupil size in two eyes, is common in most patients. But when the difference goes beyond 0.75 mm, we have to exercise caution in implanting a diffractive multifocal IOL. This is because a pupil diameter difference of more than 0.75 mm may be an indication of pathologic anisocoria, and could be due to other underlying pathological and neurological conditions. As you can see in this patient, there is a difference of more than 1.2 mm of pupil diameter in both eyes. In one of my videos earlier I had explained how to check for pathologic anisocoria. If the difference of pupil diameter of this patient remains 1.2 mm at both darkroom and normal lighting conditions, a pathologic anisocoria may be ruled out. However, if the anisocoria increases in darkroom condition, then the pupil, which is smaller, in this case the left eye pupil, is pathologic. On the other hand, if the anisocoria increases in normal lit conditions, then the pupil which is of higher diameter, that is in this case the right eye pupil, is pathologic. Another important aspect to see in this patient is the high difference of axial length in both eyes. There is a difference of more than 1.16 mm of axial length in both eyes. One question that comes to mind is the refractive history of the patient. A large difference of refractive error between two eyes may be a cause of refractive amblyopia. In a typical refractive amblyopia, also called anisometropic amblyopia, in case of hyperopia the difference in power of both eyes is in excess of 1.5 diopters. In case of myopia such difference is more than 3 diopters. However, if no information on the patient's glass history or spectacle prescription is available, we should not rule out strabismic anisometropia, wherein such amblyopia is the cause of rays of light not falling on the fovea of the lazy eye, due to esotropia or exotropia. Anyway, important clues are provided in the biometry page, and care must be taken not to miss out such important clues to choose the right patient for presbyopia correcting multifocal or trifocal IOLs.